So now, what about post-operative, like sequela? Some of the issues after the procedure, as far as the anesthesia is concerned, what are some things that the patient might be aware of if they're considering the procedure, post-operatively? What are some things they may have to be aware of?
Well, the first thing that comes to mind is that patient has to identify who's bringing them to the surgery and who's taking them home.
Yeah.
A lot of people feel very comfortable, have this idea that they can be by themselves after the surgery.
So they can't bring an Uber.
Yeah, that is.
Or go home in an Uber.
That's a standard, no matter where you have surgery in the world, is that you have to have someone to be with you after the procedure and to bring you to the procedure. Many times patients will on occasion will show up over the years for outpatient procedures, and we don't identify someone until the morning of, and that really causes a problem, and it's for their safety.
So they need to be prepared. They have to anticipate the day, the night after the surgery and the day after the surgery, and have things in order so that at home, and when they get home, everything's smooth.
The other issues are, most patients are concerned about nausea and sore throat. Those are two, and pain, and I'll discuss each one of those.
Right.
The way that we do our cases here at Trust Implants, we use intravenous propofol and remifentanil. And I do give anti-nausea medicine during the procedure, but I've had patients who've had anesthetics before where they always got sick and whatnot. And, I found that with this technique, I can't even remember having somebody that got sick here after the procedure.
Yeah, and I don't hear post-operatively, or I see them at their post-op, any complaints of nausea. In fact, they always say how they've had anesthesia for different procedures, orthopedic procedures or colonoscopy or whatever, and they say that it was such a easy experience here with your technique.
Yeah, I think it's the combination of using propofol, which is antiemetic in itself, using the antiemetic drugs, and the fact that in the immediate post-operative period, they're covered for pain with the local anesthetic that you've injected. And you inject at the end of the procedure as well, which affords them a hiatus, a period of time where there is no pain, and they don't have to take pain medicine. So that also takes that out of the experience. Not having pain immediately after a procedure is a great thing. It's a huge thing. Yeah. So, those two topics are. And
then what might cause a sore throat? Like,
we do put a tube in for breathing, as I mentioned, as we were discussing earlier. I do put a nasal tube in for breathing. Sometimes patients have sore throats after you have a tube placement.
I truly never hear that complaint, honestly. And I think it could be possibly from the glide scope, maybe?
Yeah, it can be just from having had a tube in, period.
Sure.
What I tell patients is that, you can have that experience of having a sore throat afterwards. There's no treatment for it. It's a very self-limited sort of thing, and it usually goes away within 12 to 24 hours afterwards. Not everybody gets it. It's not predictable who gets it.
Right.
But I make them aware of that, and it's usually not an issue for us.
Yeah, I really don't hear many complaints at all regarding that.